Good morning and welcome to the Daily Summation on Kurt's Religion and Politics. I'm your host. I'm Kurt. Today is Sunday, the 25th of October, 2020. And this morning I wanted to talk a little bit about the idea of the public option. I had an article entitled "What's Wrong with a Public Option?" And I wanted to point out something that I think a lot of people don't really don't really understand. And it is that where a lot of people like to make a contrast, I guess you would say, between a public option and single payer, the differences are maybe not as stark as you might imagine between the two. So when people talk about single payer, what they're talking about typically is a system in which payments for medical care of one kind or another are essentially passed through a single entity, and typically that entity is the U.S. government for the U.S., right? That's who they're going to argue should be dealing with payments. Now, the thing about that is, when you do something like that, what happens then is the government becomes responsible for paying folks. And if they have a schedule that they use to determine who gets paid for what, if somebody says, I should be paid this for what I did, and even if they can cite reasons, typically the government's response is going to be, no, you get paid according to the schedule, and that's that. And so that's how that ends up working. In other words, government essentially controls prices for medical care using single payer. Okay, now let's talk about the concept of a public option. Okay, the idea of a public option is that the government makes available plans that people can buy, medical insurance, typically plans that people can buy, and it pretty much has to be the government. That's what makes it public. Okay, and those options are designed to be cheaper than what you would pay in the private market. Otherwise, there's basically no reason for having them at all. But here's the thing. There are a couple of factors that make it so that what actually happens is costs are hidden, or the market is changed in order to make it so that it looks like what's being done, what's being offered is cheaper. And the first of these is that the government can, quote, subsidize insurance premiums on the public option by using taxation. So they can charge taxes and then use those taxes in order to subsidize what people are paying in premiums. So let's say you had a premium that was supposed to be $500 a month prior to the subsidy. Then you start taking taxes and you end up with and this is just an example. I don't even know what most people are paying for health insurance. I'll be quite honest. I know I was paying less than $500 a month, but anyway, the point would be then that they say, for example, set a $250 subsidy, so now you've got a $250 premium. So that's the first thing that they can do. And the thing is, somebody's still paying that additional money in premiums. Okay, somebody is, whether it's the taxpayer or whether it's the individual who's using the public option or whoever, somebody's still paying. And here's the thing. Well, I don't want to get too deep into this right now. Let me back off a little bit and talk about the other, which is that the government essentially, when it decides what the plans look like, decides who will and who will not get paid for their services. That's part of a plan. You say you can use the plan for this, but you can't use the plan for that. So the thing is, the two things in that sense become very similar. Now, the point that a lot of people make about a public option is, but a public option is not universal like single payer. And that seems true, but let me point something out. When people realize that the public option is cheaper and that they can get insurance that seems to them, whether or not it actually is, like, comparable to the insurance that they would have gotten on the private market, what do you think many of them are going to do? Well, they're going to go to the public option, right? Now, when people realize I'm going to pay for this public option whether or not I use it, what do you think they're probably going to do? Well, for a lot of them, they're going to go to the public option. Now, I make the statement that everybody ends up paying if you subsidize something. And I make that statement because of this reality that I think a lot of people miss. And it is, when you tax people, I don't care if it's higher earners or not. I don't care if it's everybody or higher earners. If you tax everybody, it becomes obvious why payment for it becomes universal at the very least. When you tax higher earners, they're going to pass along what they're paying in taxes in rising prices, and people are going to want higher wages in order to compensate for higher prices, which means that the prices for things that aren't even necessarily directly affected are going to be affected by what's going on. That's how that's going to work. You can like it, you can hate it, but it's the reality. Okay, and so where we are is in a place where everybody's costs are going to go up in what we would refer to quite simply as inflation as a result of what's going on there. So that's the reason that I say that. So even though the public option is probably not going to be as prone to have universal acceptance, universal use, the public option will still grow to be quite large, and part of the problem is that it will do a serious number on the private insurance companies. And again, if it weren't for the fact that they're potentially subsidizing and that they're potentially managing care in such a way that there may literally be rationing as a result of what the government says you can and can't have, because they can do things like, say, in policies, they can say things like you can have 2 eyeglass visits a year, you can have, and they can do that in ways that they would not allow the private insurance market to do. That's not to say the private insurance market can't ever do anything like that. It's to say that the government will be able to do it on their terms, and because they're not paying for care and they want to look good, they can make it so that there's various kinds of what amount to rationing. They can make it so that the quality of care is reduced, and they can also make it so that the I forget what the other thing that I was thinking, but basically the quality and the quantity of care can be affected, and one of the ways that the quantity can be affected is by rationing, and these are important considerations. So then there's another piece to this puzzle that I talk about in my blog entry, and that piece is what happens to the medical community when you start telling people it costs you $10,000 to do this appendix operation because this person had appendicitis, but we're going to pay you $5,000. What you start telling the medical community is you can't charge what it actually, in real terms, cost you to do this procedure, right? And so, like with Medicare, what's happened with Medicare, okay, doctors will say, then I'm not taking that. I'm not taking Medicare patients because I can't afford that. And the other thing that happens, what a lot of people don't realize, is a lot of people in the medical community spend huge amount of time and money and other resources to become proficient as doctors and nurses and other staff. And so those individuals have spent all of this time and money, and now you're telling them that you're not going to get paid consistent with the effort that you put in to get here. And that sounds crass, but the thing about it is, if you have a person who's an engineer and that person's gone through huge amounts of schooling to become an engineer, do you honestly think it's reasonable to tell that individual you're not going to get paid for being an engineer what you should be paid? Well, the same thing applies to the medical community. Yeah, I know there's the argument that says, but they're more in public service and people die if they don't get care and so forth. I get that. I get what you're saying. It doesn't change their reality financially. And there are a lot of people already. Look, I can't tell you how many doctors I know have investment plans that make it so that they can get out of the medical community at some point because of the sheer toll that it takes on their health. And sometimes their mental and physical health, right? There's such a toll that a lot of them have exit strategies. Okay, so I'm a little bit over what I expected, or not what I expected, because to be honest, on this topic I could talk for quite a while and probably not cover everything, but I need to just say this. If you honestly think that either a public option or trying to think what I was saying here, or single payer are a good idea, I hope that I've helped you to understand why maybe things are not as you see they are. There are a lot of people who've talked on this more cogently, more, better than I have. And the reason I did this video is I believe that those individuals can't help but be long-winded when they do that, if they do it at length. So when Dr. Thomas Sowell, for example, talks about things like that, he takes books, and a lot of people I know just don't feel like they have the time to do that. Look at it and so forth. So that all having been said, I'm going to go ahead and wrap up now. If you're tuning in on YouTube, thank you. If you're tuning in on Rumble, thank you for doing that. If you're coming to me from the podcast, that's a great thing too. I hope you have a great day. Hopefully we will see you again tomorrow. That will be Monday, the 26th of October 2020. Thank you very much for listening, and I hope your day is a good one. And hopefully we will see you again tomorrow. Thanks for checking out this video. Remember that you can like it on YouTube and you can give it a rumble on Rumble if you want to do that. I have channels on both YouTube and Rumble. They are the Kurt's Religion and Politics channels. You can subscribe to either one of those if you want to do so. Remember, if you subscribe on YouTube, you probably want to click the notification bell in order to be notified of new content. If you want to see more from me, you can check me out on my blog. That's blogs.kpschubert.com, blogs.kpschubert.com. You can also see my Facebook page, that is Kurt's Religion and Politics on Facebook. You can check out my Twitter, Parler, and Minds.com accounts. My handle on all three of those is at kpschubert. That's at kpschubert. You can check out my podcast. The podcast is at podcasts.kpschubert.com. That's podcast.kpschubert.com. And finally, you can check me out on Patreon. And if you want to support me, that's probably one of the better places that you can do that. I am Kurt's Religion and Politics there. Thanks again for checking out this video, and hopefully we will see you again tomorrow.